I know from my own experience that it can be daunting going to a medical appointment, and particularly when it's for something like breast reconstruction or a conversation around what your breast reconstruction options are. It can be useful to know what to expect at your first appointment. First thing is we need a referral. And a referral can be from your breast surgeon or from your general practitioner if you don't have a breast surgeon or if you're coming for, say, a second opinion or something. But the referral is very important because it captures your medical information and it hands that information to me in a way that I can understand what your health parameters are. The second thing is that you'll meet with me. We usually have about 45 minutes during the consultation, but sometimes a bit longer if there are more questions that need answering. We'll go through your medical history, and that can include details about the cancer diagnosis or if you have a gene mutation. We'll talk about your breast size and your breast goals. So one of the things to think about before the consultation is whether you're happy with your breast size, whether you would ideally like to be a bit larger or smaller or more lifted. All of these things are really important for me to know in order to plan and personalize your treatment. So have a think about that before the consultation. We'll also talk about whether you're a smoker or if you've ever had any allergies before, whether you've had any surgery on your tummy area or any other surgery on the breasts. These things can all be really relevant as to what kind of reconstruction might be suitable for you. We'll furthermore talk about what your thoughts are on implants and whether you're interested in having a silicone implant or whether you might prefer your own tissue and what your thoughts and feelings are about these things. And so come prepared with questions if you do have any, or if you've thought of things, write them down in a little list so that you can ask those questions and make sure we cover everything that you're worried about during our conversation. The second step of the consultation will be an examination, and that's obviously my opportunity to see where you have different types of tissues that we might be able to use to build breasts. So we can look at the tummy area, we can look at the thigh area, and we can decide if there is enough there, we think, to be able to reconstruct breasts for you using your own tissue or not. I'll also do this a bit of a sit-up test just to check your abdominal muscles and see how they're working. Obviously not everyone can do a sit-up, that's not a problem. We just need to know to be able to document that and check that there's no hernias or any other problems that we might need to consider when performing the DIEP flap surgery. Finally, at the end of the consultation, I'll give you the chance to ask any more questions that you'll have, and I'll also show you before and after photographs of women that are in a similar situation to you. And I think that's really important to choose before and after photographs that resemble you and your body size and your body shape, and also your goals for what you're aiming for. So I'll generally try and show you women that are relatively similar, but might have some differences, and also show you examples of what scars may look like in 6 months and 12 months and 18 months, because obviously that's something that you might be concerned about. And then finally, I'll ask if you're interested in speaking to other women who've had some personal experience with this operation. We've got a long list of patients who we've operated on that are happy to talk to other women and recognize it's a difficult decision. And so speaking to women with lived experience, we think, is really important for you to be able to feel confident to move forward with an operation like this. So we'll be able to give you at least 1 or 2 names or numbers of women who are similar to you and have a similar body shape and size, because that's important as well. Finally, we'll run through details, logistical information. My team will speak to you about health fund issues, item number checks, whether you're potentially going to the public hospital system. All of those things can also be discussed at that time of your first appointment. So plan to come for at least 45 minutes for the consultation. I promise to try to run on time, but I don't always. And then you may also need to spend a little bit of time after the consultation talking to the office staff and making arrangements for the next steps, which usually includes a CT angiogram, which is a CT scan we do that just looks at the blood vessels in the tummy. So hopefully that's been helpful and gives you some information about what to expect at the first appointment. But obviously, if there are any other questions, just ask my team. We'd be happy to help.